Welcome back to She Blooms podcast, where we empower, inspire, and help you become the woman of your dreams. I'm your host, Liana, and we're diving deep into a topic that affects so many women around the world: PCOS, polycystic ovary syndrome. We're joined today with the incredible Dr. Shevon Joseph, a powerhouse in women's health with over a decade of experience. From South Trinidad to New York, she has been making waves as a board certified OBGYN, especially in caring for minority and immigrant women. Dr. Chiffon is here to break down PCOS, share her expert advice, and empower you with the knowledge and the need to take charge of your health. Welcome, Dr. Chiffon.
Good day. Thank you, Liana. Such a nice introduction. Thank you for having me.
Yes, it's my pleasure. So, can you introduce yourself as well? Anything that you would like to tell my audience about yourself?
Well, you did quite a good job there as far as I'm concerned. But yes, I am from South Trinidad. I am US trained and licensed, but I returned to Trinidad about, I think, 7 years ago. I just realized when I did the math. And I am the
Yes.
current medical director at Azalea Health Services, which is a women's healthcare practice located in Woodbrook, Port of Spain. And yeah, we've been chugging along, just doing all that we can to improve women's health and the quality of services that women receive in the healthcare sector.
Wow, that's amazing. So, what inspired you to specialize in reproductive health?
Well, during your med school initial first to second year, they tend to give you the exposure to all the different career options. And I definitely, from an early start, landed in the world of women's health. So, counting from medical school to now, it's been about 20 years and counting of just focusing on women's health. It has been a privilege and also what I recognize as a calling for me, since the female reproductive system is quite complex. It's multi-layered, multifaceted. So I have an acute awareness of the importance of helping women understand their bodies and various conditions that they may experience. So my focus is not only in the medical management of the conditions, but I need you to understand what you're going through, because I find that an educated woman ultimately will be the healthier woman in the scenario as well too. So for the past 7 years, using Azalea Health Services as a platform in the social media and online arena, I've continued to try to provide free, accurate health information and explanations of conditions to women pretty much everywhere.
Yes, that's wonderful. No, your health is your wealth, and your webinars. Speak about that.
So I think I've done at least 65 live presentations, or all centered around polycystic ovarian syndrome, which is how I could best explain how complicated it is. Because a lot of these
Yeah.
sessions were not repeats of information. It's just so much information. So during the pandemic, I started with the lives. Initially, it was on a platform called Clubhouse, so it was audio, and the rooms would start filling in, and we started recognizing that women were really seeking information. And yes, you do your research online, but what I found myself channeling towards was giving you a better way to search online, giving you the core information based on studies and data that can better guide you. So for me, those live sessions, and right now we have Wednesday webinar that's running, again, free webinars. We also were able to complete a pretty extensive study of women within the age groups of reproductive ages. I reviewed women that we saw from 2018 through 2022 at my practice who were classified as in some way, shape, or form dealing with PCOS. And from that, we detailed a lot of trends that may not align well with what the text and the global community quotes. Some of our numbers we found were a bit larger number of women being affected. So we
Yeah.
published information on our website, azaleahealth.tt.com. And a lot of patients are now coming in and saying they read the study, they saw themselves in the data that we presented. And it does help women with PCOS better understand their individual and unique condition.
Okay, is that research Caribbean research?
Well, what I did was what's called a retrospective chart review. If you came in to see me without delving into your personal information, we pull trends. So it's
Okay.
actual women that sat in front of me in the office that we got their family history. For instance, we looked at the numbers. If your grandparents have type 2 diabetes, then what does it mean for you in your 20s with polycystic ovarian syndrome? And we just kept pulling all of these trends and looking at data and then comparing that data to the World and Health information, for example, the whole World Health Organization information. We saw things that were unique to women here in Trinidad and Tobago. And the
Oh,
next leg of this would be for me to extrapolate this now to women across the Caribbean. We have so much data now that we've accrued what's going on in women of East Indian descent versus African descent. Like there's just a lot more to uncover.
yes. And so, what is the, do you have any personal or professional experiences with PCOS?
I believe I would have to say yes. From a
Mhm.
personal experience, I knew my family history of type 2 diabetes myself is something
Yeah,
that I have full knowledge of my genetic risk for this as I get older. My professional insight would also be that even in scenarios where women had symptoms, I would always encounter women that were unsure what the symptoms meant. The most common question I get asked in my practice is this normal? Is this
mhm,
normal? Is it just me? So I do, from a profession, have a professional insight that a lot of women have symptoms but haven't been diagnosed properly or they don't know how
yeah,
to manage them properly. And then the internet is just fraught with misinformation. And
yeah.
even some healthcare professionals who may not be properly educated or updated on the condition, I too often would encounter clients with unanswered concerns and frustrations about symptoms that were not adequately managed. So I feel on the personal level, I have the educational background and the know-it-all to help push these women in a better direction in terms of managing their symptoms.
No, I totally understand. Like our generation, everything is looking it up on TikTok, on YouTube. So coming to a professional and getting to know the real tea on it is really important for us to be educated in this and take you,
Absolutely.
yes, and
And I
take the,
don't stop my clients from doing the Google search. I just
yeah.
more so prefer for you know to know what you're Googling.
Yes, that's so true. And also, you said diabetes. Is it linked to PCOS? Because I know I did a lot of research, and your health and your diet is so important with managing PCOS symptoms.
Yes, absolutely. So there are varying types now of PCOS. It's a lot more
Okay.
research is needed, but just within the knowledge that we have, some women, I describe polycystic ovarian syndrome as an umbrella syndrome, meaning
Yes.
that if I had 100 women diagnosed with PCOS, everyone within that umbrella would still have their unique experience with PCOS. So we do know that there's a link to insulin resistance PCOS, which then promotes the risk of diabetes later on. Prediabetes sometimes is diagnosed in women a lot younger than what traditional medicine would think. And also a lot of the features, the physical features of PCOS can be managed by regulating how your insulin performs, including skin changes, weight management. So there's an absolute risk of developing diabetes when you do have PCOS. Some of this again needs to be studied some more. Some of this is, which is chicken versus the egg, which is causing
Yeah.
which, but the link is quite established.
And what are some myths and misconceptions about PCOS, you would say?
Oh boy. Well, okay. So one of the major ones would be that PCOS causes infertility. I can't tell you
Okay.
how many times there's been unplanned pregnancies, women who
Mhm.
just assumed, hey, I have PCOS, or they've been told rather that they will never get pregnant, which I think is a myth for sure.
Okay.
I always
Because
tell clients,
that is the number one Google search,
yes.
infertility. Yes.
So there is an element, remember I described an umbrella. So there's
Yes.
an element of infertility depending on how irregular your ovulation pattern is. It does not mean you're infertile. You may have
Okay.
some delay to conceiving, or you may definitely have no issue at all conceiving, but manifest the other symptoms of PCOS. So I would say number one would be PCOS causing infertility. It is not only a fertility problem, that's the other thing. So some women who may not necessarily be planning a pregnancy or investigating their fertility chances will still remain with polycystic ovarian syndrome symptoms and not
Mm.
evaluate them because they don't see they assume the link is there with fertility. So that's number one. And then within that myth of it causing infertility, there's a substantial number of unplanned pregnancies that can happen to women with
Oh,
PCOS, right? Which I see quite a bit of. The second one is that my periods will be irregular once I have PCOS. Based on our study, based even on the data that we see out there, the data says 50% of women will have irregular menses. Our study, we certainly saw that mirrored as well too. So bleeding patterns do not have to be irregular for you to have PCOS. Majority, 50%, as a large number of women, will have some irregularities, but even within that 50%, they may have periods of time where they're very regulated and other times when they're irregular. Within that myth of irregular menses, my bleeding pattern or a woman's bleeding pattern will vary, not only from PCOS, but a woman with PCOS could have fibroids, endometriosis, adenomyosis. My prolactin hormone level could be off. I could have a vitamin D deficiency. My thyroid could be off. So my bleeding pattern does not always indicate my PCOS status, if that makes sense. Um,
okay.
then another common one, which I think your generation, I think is going to have to model through quite a bit, is
Yes.
PCOS means that I'm obese. That's not true.
Oh,
Women with
mm,
PCOS are not always obese. 58.4% of women, and that's numbers like burned into my brain that at least 60% of the women, yes, find they were overweight or obese. But what I see regularly, and if any of my clients see this, they'll probably know that I've called them out for having skinny girl PCOS or lean PCOS. So we saw at least 36% of our women would be considered quite normal weight, nowhere near
right.
being overweight or obese, but still manifest some aspects of PCOS. And
Yes.
5% were underweight. I'm talking, I have clients who are 91 pounds soaking wet, but still
Yeah.
dealing with PCOS. And that too, I am most nervous for because they won't be diagnosed properly. The myth would
Mm,
be that you have to be obese. So they would be struggling with hair and skin issues. They'll be struggling with fertility. They'll be struggling internally with diabetic risk. But because their physiology, their genetics, their
yeah.
metabolism, they're quite thin. They do also get missed in the diagnosis as well too. So I
Okay.
could go on and on about the myths, right? So
Yes.
those are the key ones that jump out, that can't have kids, you must have
Mm.
irregular periods, and you are obese.
No, I'm glad you touched on all those myths, Dr. Shevon. And I think it's so important that you get diagnosed. And how would you go about getting diagnosed, knowing that you
So
have those symptoms?
what I used to, sort of come up with a lecture when I worked in the States. I would have residents and trainees and so forth. And I don't think the information we impart to medical students is that complex that you yourself can't understand it. So I still stick as best possible to the current data. And the diagnostic criteria for PCOS is not just what I see in front of me. Yes, I'm going
Okay.
to do an intake of your symptoms and your physical attributes. And definitely those will give a strong inkling that, hey, this might be PCOS. But as I said before, if you also have a thyroid issue or you have other hormonal imbalances, there's an overlap. And of course, you can have PCOS as well as other things. So in the diagnosis, to really delineate the true thing that you're being affected by, we look at the symptoms. Then pelvic ultrasound is usually something that has to be done. The pelvic ultrasound from an irregular bleeding standpoint to look at your anatomy, to look for the changes on the ovaries consistent with polycystic ovarian syndrome as well. So an ultrasound is important, but the ultrasound gives so much more detail in terms of future fertility chances, concerns that may need to be managed more aggressively, like large fibroids, large ovarian cysts, and so forth, which will also create some symptoms. And then, of course, blood work. And that's where I think I see there's a gap in diagnosis because a lot of women may not have the right approach from their medical doctors and so forth in establishing what their blood work looks like. The laboratory testing is key. We're now
Yeah.
looking at a minimum of 4 different types of polycystic ovarian syndrome, and who knows what's coming down the pipeline. So blood work, screening for, maybe I am actually already diabetic, that I need to see the blood work
Mm.
for that. Thyroid
Yes.
function, all women starting age 25, really,
Okay.
PCOS or not, should start basic screening for thyroid and because your thyroid affects every cell in your body. So the blood work not only is key to help diagnose PCOS, but it helps to rule out other things that might be more detrimental to your health than PCOS.
Okay. So at age 25, is that a perfect age to get tested, diagnosed for PCOS?
Actually, no, I see teenagers, and
Okay.
teenagers is a little trickier because we do have to accept some amount of irregularities in teens with their menstrual cycles. We also know their bodies are changing, their breast structure is changing, their body fat percentage is changing. So I don't endorse completely going as aggressive with a teenager in terms of management, but they do still need to be assessed and managed as best possible. The other thing is 25. When I said that, I more so mean whether or not you're concerned about PCOS, basic screening should start around that age. Age 21,
Okay.
if you're sexually active, and I know you had a podcast already about HPV and pap smears and so forth,
Yeah.
but thyroid, diabetic screening, blood count, anemia screens. Definitely from at least age 25, every 2 to 3 years, a woman should start getting in the habit of checking these things. When you
Okay.
are 40, we're adding on cholesterol to that list. But let's say your mother's family all dealt with cholesterol elevations at a younger age, we could start screening at 30 instead and so forth. So regardless of whether you know or not you have PCOS, there is this movement, I think, where women have to sort of decide, hey, I'm going to just screen for things so I'm not caught off guard or blindsided by a diagnosis.
Yes, as you say, prevention is better than cure. So
Yes,
screening and checking yourself so that you can implement those healthy lifestyle changes. So what would
absolutely.
you say is an effective lifestyle change that we should implement if you have PCOS to help
Well,
manage it?
it's so easy to say it. It's harder to enact it and actually enforce it in your day to day. But maintaining a healthy weight, whether you're
Okay.
struggling with obesity and you need to lose weight or you're underweight, hormonal balance, hormonal management, really the key in managing that is absolutely a woman maintaining a healthy weight. We store a lot of our reproductive hormones in our body fat tissue, right? So breast
Yeah.
tissue, the fat that's there, that's where estrogen is stored and so forth. So just finding a balance, because if I'm underweight, I may have a more regulated menstrual cycle if I do have a healthier weight for me. If I'm overweight, exactly the same concept as well. So weight management is important, and also retraining the insulin resistance situation. So if I have insulin that's not working for me, it's a hormone. It's supposed to help process my sugars. If I eat a more balanced, high protein, dense, complex carbohydrate, low sugars, then my insulin actually will function better and I might escape the need to be prescribed medications and so forth. Cutting back on portion size, learning and understanding your relationship with food is something I speak a lot about, because sometimes
Yeah.
we just have a toxic relationship with food, just like an ex or something, where food
Yeah.
functions this role where we use it for managing emotions and situations sometimes, and then sometimes there's restrictive behaviors, and all of this could impact how your hormones function and how ovulation works. So maintaining a healthy weight, I would say, is a top one. And of course, exercise. Exercise is the main basic way that your body balances its blood sugar levels. So if you have PCOS, and this is where the skinny girls, I have to sometimes keep reminding them, you got to go to the gym too. You
Yeah.
you you have to do
No.
resistance training as well. Even if you're 100 pounds, you have to exercise or do high intensity training. And within that lifestyle change where exercise is concerned, I do have a tendency to encourage women to, as you understand your menses, when is the best time to do certain types of exercises. Premenstrual, those few days or week before your period may not be your hit week. This might be your Pilates week or your week where
Yeah,
you do yoga or you do more stress relieving things pre-period, with reserving things like the very high intensity exercises for after the period. All of that rolls into PCOS management as well too, in terms of lifestyle changes.
that's kind of like cycle syncing, right? Where
Yes. Yeah.
you go on based on your period and your energy levels. You do certain exercises. You maybe not go harder in the gym. You might do Pilates, as you said, which Dr. Shevon and I do all, right?
Yes.
I
Good.
but
Yes.
they hit the Pilates. I've been liking Pilates more. It's low impact but high intensity,
Yes.
and it's really good for your core and everything, but it's great just from those days that you're not feeling like a burst of energy and you're maybe on your period and you just want to slow down but you still want to maintain your weight. It's so
Yeah.
good with yoga and Pilates. I think people should implement that to create a balanced lifestyle and include their diet as well. So I do really eat a lot of fish, a lot of seafood, a lot of smoothies, implement a lot of Caribbean foods in my diet as well. So I think that we are so blessed to have so many great, rich foods that we should just
Yeah.
implement it into our daily lives.
Well, that's where I talk about your relationship with food. Having grown up in a Trinidadian household, one of the things I would talk to my clients who have PCOS about is, let's say, for example, Sunday lunch, right? What is
Yes,
the Sunday lunch that we grew up with? How much on that plate actually works for my PCOS, and how much of
yeah,
it can I edit? Can I edit my traditional foods? And then also the regularity of certain foods, right? We live in a place where the convenience of some street foods for some women, you're busy,
definitely.
you're in school, you're working, you have goals you seem to set out to achieve, and sometimes diet and nutrition falls to the wayside because you're so busy. So it's
We can
definitely
be.
looking and seeking for that balance of, I want consistent habits that will sort of keep me managed.
I think meal prepping helps with that, where to keep a healthy diet and everything, and you're tired and you're going to work and school, meal prepping overnight. I know it takes a lot of work. Sunday, do that, put aside, and you have your broccoli, your quinoa, your salmon, and you look up little different little recipes that you could switch up. Because I know some people don't like to eat the same meal every day, so maybe
Right,
have it maybe 3 times instead of the whole week. So I
right.
think meal prepping is so important to keep a healthy, balanced lifestyle as well. Preparing and planning is the key to these things, and being consistent and disciplined with yourself as well. And I like
Absolutely.
and I like that I like that you said our Sunday lunch. Yes, I love my Sunday lunch too, right? I love my macaroni pie and my stewed chicken and all of that. And your avocados. Those are rich and heavy in fats as well. Avocado is really good. But I think putting more greens into your foods, like
Mhm.
maybe instead of having a potato salad, maybe have a broccoli salad, something a little bit more
Absolutely.
green and leafy, rich. Yes.
Exactly. Well, on a personal level, checked back, and I believe either 28, if not close to 29 years without meat, me personally.
Wow. Okay.
I
So you're
This was a
vegan,
personal choice. Yeah. I don't tell
mhm,
people not to eat meat, but even if you
right?
are eating meat, the way the meat is prepared,
Yes.
the type of meat, how lean the meat is, and so forth is important. But from a personal standpoint, I'll do, instead of pilau, I'll do a
Yeah.
quinoa pilau instead, because
Wow.
get protein in there. So I encourage patients to experiment as much as possible. You love
Yes.
pilau? Let's see how we can transition this and transform it rather into a healthier option. Just sort of working through those things so you don't lose touch of what feels good to you culturally. But sometimes the cultural foods are also part of the issue for women with polycystic ovarian syndrome.
Would you say stay away from the heavy oils as well? Go towards more of the olive oil?
Yeah. And
Mhm.
people quote expense sometimes when I talk about staying away from certain types of oils.
Yes.
Whenever the conversation comes up in my office about how expensive these things might be, by the time you actually change your perspective and think about the expense of being an unhealthy 50-year-old, an
Hmm.
unhealthy 60, 70-year-old, it works out to be actually
Yeah.
a lot more cost effective. So healthier oils is something that I would always endorse, like avocado oil, olive oil, and so forth. And even in that realm, less is always going to be more.
Yes, definitely. And I think people need to change their mindset around the expenses of things and think about, as you said, how am I going to be when you're 50 and have to buy all these medicines, these medications, because you did not invest in your 20s into your health? I say you need to invest into your 20s or your late teens, into your youth, so that you can
Yes,
be
absolutely.
thriving in your 50s,
Absolutely.
60s. You want to be a
Well,
vibrant woman.
I think up to this week, I had a 21-year-old in front of me
Yeah.
who's sort of living the way she knows to live, right? She's not
Yeah.
independent enough to live outside the household. So the food
Right.
choices really come collective with what the family is eating. But she has a personal goal in mind in terms of how to better manage her symptoms that are likely due to PCOS. And my
Mm.
conversation with her, I asked her because I think at 21, I've been 21, a lot is going on, and
Yes.
sometimes you don't have the broader picture in mind. So one of the
Yeah.
things I sometimes will ask someone in that age group is, okay, let's just paint a scenario. 45-year-old you is in the room. She's sitting right here with us. Is she upset at you? Is she regretful? Is she angry at you for some of the choices you're making now? Or is she patting you on your
Mhm.
back and saying, good job, you did it? What is the future you thinking? That's the way
Yes.
that I try to paint that picture.
I love that mindset because as young people, we need to think about that because everybody ages, everybody's going to get older, and we need to take care of ourselves now so that we can live a long, fulfilling life.
Exactly, exactly. Goals.
Yes. So I've heard about medical treatments when it comes to PCOS, like birth control. What are your views on that?
Well, so birth control. I speak about it as frankly as possible. And I've done,
Yeah.
again, all of these lives, and I talk to women on a daily basis. My teen sessions, a lot of times with the parent in the room, I do identify from the jump that, yes, the birth control pill has some risks to it. The birth control pill, I think, has been demonized quite a fair bit in society.
Yes.
I think women
Especially
are
when you're in a household, yes.
Yes, yes, because then there's the aspect of I don't want my kid to start the pill. I generally don't start teenagers on the pill until they're at least
Mhm.
16 to 17 years because, again, more data is needed on what the
Okay.
impact of being on the pill at 13 might mean. And there are some irregularities we do expect in 13 to 15-year-olds and so forth. But the pill can also be viewed as life saving for a lot of women who
Mm.
may be avoiding unplanned pregnancy, may be avoiding
Yeah.
profound significant anemia because their periods are better controlled on the pill, better quality of life. Every month, I'm not necessarily in dire discomfort because the pill is helping to reduce some of the symptoms of menses. Scarring, acne, which could be disfiguring and affect someone's self esteem and how they live, things like facial acne and so forth. The pill really has been an instrumental tool to manage certain things. But what I also say about the pill is that it's not a cure. It's more
Yeah.
so that you get through this period of time with better symptoms. So it's to help manage symptoms, underlying that you still have the issue of PCOS you constantly have to work towards. But not everyone gets put on the pill, clearly. And if you have reservations to being on the pill, there are side effects. It's hormonal. So there are things we should look out for, and there are some risk involved. But I have a frank discussion. And the key with any prescribed med is to observe how you feel on it. The good thing about the pill, one of the good things about the pill also is that it is a method that's easy to start, easy to stop. So if I try it and I'm not seeing the impact I want to see, or I'm experiencing side effects that I can't tolerate, stop the pill, right? So the pill is on the list, but it's not the only thing where PCOS is concerned, especially once the blood work is completed. Some women
Yeah.
need their thyroid to be managed with thyroid medication when they have PCOS. Metformin or something similar can be used for insulin resistance to improve how my insulin works. There's a world of herbs and blends in terms of metabolism issues, balancing sugars, moods, things like Vitex and Inositol, berberine, ashwagandha. The list is long. And then there are mineral deficiencies that women might experience more profoundly with PCOS. So for moods and PMS and PMDD and so forth, which has a definite impact on women with PCOS. There are things like magnesium glycinate that I tell women that definitely, before we reach even for that pill or for anything more prescribed, what minerals am I missing? What is my
Yeah.
zinc intake like, right? Because even as a vegetarian, I don't get much zinc or B12. So, and some people may have absorption issues in the gut. So making sure your vitamin D, calcium, zinc, B complex, folic, as someone with PCOS, even just blending those things in more consistently will improve your symptoms as well too. Other
Okay.
medications, it depends on the goal you have. If you want to start a family and you are dealing with ovulation that's disordered, we have agents that can help induce ovulation and regulate and improve the chances of conceiving in a woman who wants pregnancy. Then I do have sort of a symbiosis with the dermatologist because acne, hair loss, hirsutism, or excessive hair growth, I need agents more along the line of a dermatology prescription, things like spironolactone or also known as aldactone, minoxidil, which is Rogaine, is really the only FDA-approved agent to reduce hair loss in women with PCOS. So it's an extensive list. So it really comes down to the individual at hand and what symptoms they are most impacted by.
So that's why you implement more natural remedies and supplements before you take that action in going for the birth control or the contraception
Yeah,
pill.
well, again, it depends on you and what's bothering you the most, to be honest.
Yes. If it's
But
severe.
my approach is always if we could get away with the right blend of herbs and vitamins and supplements and you
Okay.
feel better, then sure. But it's not always going to be the case. And then at the root of polycystic ovarian syndrome is the issue of not enough knowledge, not enough studies. We need more information. More is coming out gradually, but also
Yes.
the other problem is there's no cure. So I
Okay.
can have my PCOS in control for 5 solid years and then have a year of chaos, right? So
Yeah.
I
Hmm.
may not always need to be prescribed something, but there are going to be moments there where I have a condition. So I encourage people to think about it just like any other chronic condition, just like high blood pressure or lupus or something of that nature. And then behind this medical management is the understanding that there's an inflammatory aspect to PCOS as well too. And that just comes down to certain foods might trigger my body to behave a certain way. Certain levels of stress will trigger my body to behave a certain way. So if I'm you mentioned turmeric, I believe that's a powerful, potent anti-inflammatory. What if I just need to roll some more of that into my consistent
Yeah.
nutrition
Your
because
diet.
does have an
Hmm.
inflammatory aspect to it. So things like sugar, alcohol, white rice, pasta, so forth. Am I now in a zone of I have to scale back on these things so my body could get better control of my symptoms?
Yes, I think implementing these little things like turmeric or ginger or whatever herbs into your diet is so important. Your smoothies as well. So
Mhm.
maybe you don't like the taste, but masking it with some fruits and veggies, your favorite fruits and veggies, and some honey, that will be perfect. So you pointed out your mental health and how it's important and with dealing with PCOS and how PCOS affects your mental health as well, like your physical health and your mental health. So what would you say to help that?
Well,
Going
I don't see how we can be talking about hormonal imbalance and so forth and not talking about mental health.
yeah.
And we have data on this, right? So in
Mm.
our study, for instance, we found that close to 40%, I believe 38.9% of women in our study actually suffered with aspects of depression. And it kind of makes sense, right? If I'm not ovulating or my hormones are off, or just even if I am ovulating, but my acne is out of control, or I'm thinning or balding, I have alopecia, whatever the situation might be, absolutely depression remains on the table as a risk factor. Gut health, right? I talked to a lot of women with PCOS about maintaining a healthy gut because that's where we make serotonin. Some of the lives I've done in serotonin, the participants in the lives were like blown over the fact that, wait a minute, my hormones are off. I'm very bloaty and gassy all of the time. So my nutrition is off. And that also means I'm throwing off my serotonin and I'm more prone to depression. It's all related. Now, other studies that we looked at comparing to others found that anywhere between 27 to about 50% of women with PCOS reported depression, but our concrete number we got was 38.9%. Rolled into there was anxiety as well. But
Yeah.
what we did, or how we looked at the trend, it were women who actually answered questionnaires and admitted to symptoms of depression, women who were diagnosed officially with it, women who were being treated with it. Because that's the other aspect. Sometimes women are coming in already on antidepressants, but they didn't have blood work done, or they did not have a proper evaluation of their hormonal status. So the antidepressant may not have even been needed, right? Or it could work better if we could better delineate what's going on with you.
And what would you say it's like a self-care? We're talking about self-care and managing your physical and your mental health. What are some self-care tips you could tell the ladies that you as a queen you do on your daily basis?
Tips. For me, I need visual cues, right? So I am talking to you on video right now. I think over my, what is this, my left shoulder. This is a portrait of Lena Horne. Lena
Yes.
Horne was a African American actress, also an activist and so forth. I keep her as a visual cue around me because she passed peacefully at the age of 92. She was
Mm.
known for her consistency. She also treated herself to one square of dark chocolate after every meal. This is when you look up her story. There was this consistency where she paid attention to her nutrition, right?
Mhm.
So my tips would be consistency for sure. Also, in the office, I have portraits up of Billie Holiday. Pam Grier is another example. Her portrait is up as a visual cue because she's an actress. She played Foxy Brown. She's still alive, gorgeous woman, probably in her mid 70s by now. But I keep her as a visual cue, sort of to keep in mind when Pam Grier, and this is not a polycystic ovarian situation, but she actually was one of the first celebrities to be diagnosed with cervical cancer, right?
Oh,
She'd made some
wow.
she'd made some choices. She used to date Richard Pryor, and he was kind of he was around town quite a bit. I believe she
Yeah.
dated a basketball player, Wilt Chamberlain. So anyway, she got this. I keep her as a visual cue because she was told she had less than 8 months to live, or something was her story. She did what the doctors told her to do, but she also rolled in quite a fair bit of Chinese medicine into how she managed.
Right.
So I keep her as a visual cue to know from a professional standpoint, if my patient wants to drink bush tea, I'm like, go ahead and drink it. I can't tell it's not going to work. So I encourage women as a tip to lean into what you think works for you. If drinking
Yes.
turmeric and ginger helps with your cramps and your moods, then turmeric, ginger away. But let's just keep a consistency with whatever your choice is, right? So from within me, I try as a woman's health professional to walk the talk, right?
Yeah.
So
Definitely.
I work out. I do work out. I don't like it sometimes, but you got.
Yes. Anybody who really likes working out, but it's good for us.
But I do
Yes.
it. And so for me, what I do know right now in my state of age grouping and your mom's age group, I do resistance training. I do boxing, for instance, because I do
Love
know
that.
we have to maintain our muscle tone, right? And
Yes.
hormonal balance, menopausal symptoms, PCOS symptoms, all of those things where weight and resistance training comes in, Pilates and yoga. So I am not a stranger to those things. And I can then sit with my client and confidently say, yeah, boy, working out sucks, but I went yesterday. When did you
Yes.
did you go this week? Because I can't really sit and talk and guide and counsel if I'm not also living it myself. And
Yes.
that was
Living
just
in
a
your
personal choice. Yeah.
truth.
Years ago, many, many years ago, when I was a young doctor in New York, I remember being appalled when I would see in the hospital doctors outside smoking their cigarettes. Like, what are you doing? Right. One of the
Yes.
first hospitals I worked in, there was a McDonald's in the lobby. They changed that. There was a McDonald's in the lobby of the hospital. So for me, it's like, what? So I try personally to look at the way I eat, and I'm not perfect. I'm not perfect.
Yes.
I still have my moments, but that's also called
Your
being
cheat
human.
days. Yes.
Right.
Definitely.
But consistency, when you look at the full picture, there should be majority of times when you are managing things with consistent habits.
You take care of yourself, and what you preach you do as well, so you're leading by example. And I noticed that my mom started eating dark chocolate, so I was like, what is going on with this dark chocolate thing? Is something linked?
We're allowed.
Researching, like just like you said, the celebrity, she did her Chinese herbal medicine. I think researching different cultures as well, because each culture have their own unique and very special ingredients and foods that also need to be implemented into your diet.
Absolutely. And we even did a study. This is about 8 years ago when I was in South Brooklyn. We looked at our Muslim clientele who would fast. And this was to identify the pros and cons of intermittent fasting by looking at communities that fast for religious purposes. And it was quite eye opening because when you look, and I don't know the exact numbers, but you can even look it up, certain Middle Eastern countries have even worse PCOS rates than the Caribbean and so forth. You look
Wow.
at places in the Middle East, their PCOS rates are really needing to be investigated. And what we found in our smaller community, when we looked at it in Brooklyn, is what you break your fast with is so important. So if I'm fasting for religious purposes, and some of these communities, they would fast 3 to 4 times per year, right, for Ramadan and so forth. There's a
Yeah.
power behind intermittent fasting where PCOS is concerned, but a lot is not known. And also, a lot of people don't do it the right way. So, when I encounter someone who's looking at that as an option, I don't knock it. I'm like, you know what? It definitely gives a metabolism boost for some people. It helps with the weight loss. But what are you going to do after? And how consistent are you going to be with this? And is this sustainable? So a lot of times I do find it important to liaise with a licensed professional nutritionist or dietitian
Okay.
to hone in on the right way to do certain types of diets.
No, that is so important to get a nutritionist or a dietitian to know your body and what is good for you to really get on your diet.
Yes.
And so, what do you say you would break your fast with then? Something, a healthier option.
Well, we're still definitely sticking in the realm of protein intake. We do know that the majority of women, probably you and I included, are
Mhm.
never truly hitting our daily protein, recommended daily protein intake. So if I'm intermittently fasting, then I'm even more at risk for not getting adequate amounts of protein. And then no matter what workout regimen I'm following, I am going to be suffering from muscle fatigue, of poor recovery. I may not see the changes I think I should be having with all of this working out. So protein management and how you get that in there, how you calculate your calorie deficits and so forth is important. So it's a little much more complex. And the average client that comes into me asking about intermittent fasting, they always
Mhm.
agree because I had an experience too. I didn't learn about it in medical school. It wasn't a thing. But when you see the ads for it on social media, you click again, and then it takes you nowhere because you got to pay for more information. Or it's a
Yeah.
bunch of word salad and not really
Mhm.
giving you any insight. So that's where actually investing in yourself by getting one or two consultations with a dietitian, setting out properly aligned goals, your meal plan and so forth, with
Mhm.
your goals in mind, and also with someone who's in touch with the actual data.
Do you have any memorable stories of women that has struggled with PCOS?
Ah, of course, of course.
Yeah.
I think my most memorable stories would have to be along the line of successful pregnancies.
Oh wow.
Um, I don't know how many babies I've actually physically delivered. There's quite a few of them out there. But I do know that my memorable stories would definitely come from that realm because these are people who would have come in not thinking it was possible.
Yeah.
Um, so not too long ago, I was up at Las Cuevas Beach. Here in Trinidad, we have Las Cuevas Beach. I went early in the morning, and again, this is part of me from my personal tip, having out time to reset and manage your
Yes.
stress and so forth. So I'm on the beach quite early in the morning, and there's a family, man, woman, and a child, and I didn't recognize the woman in any way, shape, or form, but she recognized me and she calls me Dr. Azalea. I said, hey. And then she's like, there's your child. And I was like, my child. And then she reminded me, yeah, they had I don't know, like a 4 or 5 year journey of infertility before
Oh,
and she had by that time had been even given fertility meds by her doc, but there wasn't the right testing done, the right groundwork, right, in terms of figuring out what the issues were. So we took that challenge up quite readily. And this particular person, just like everyone else with a success story, she invested in herself. She
yeah.
stuck with a consistency that was quite impressive. And they have a daughter. And I kind of always have this ability to move on to the next. As a doctor, you stay busy. But in those moments, I didn't recognize her on sight. But then as she reminded me and I see the kid, it just all came full circle that wow, their life has really, really, really taken a very positive pivot because we did pin down her issues with her polycystic ovarian syndrome. In this particular case, she did have insulin resistance that was being ignored. She did need assistance to manage that. We did have to prescribe a couple of things, and then the conception happened. And yeah, she has a daughter who is playing and digging
Wow.
sand. So it's always pretty amazing.
That is so lovely. Like to be such a great impact, a huge impact on people's lives, and then see it full circle come to see that, how much joy and how much love it brought to their lives. That is just,
Right, and mom did and dad, they did
yes,
the work. She did the work.
yeah.
She worked on
She stayed
herself,
committed.
but
Yes,
she just needed
I love,
the guidance.
yes. And having a supportive community and people that are there throughout the journey is so important. And we
Mhm.
touched on mental health as well, and that you also go to the beach and you have your time there, and I guess you really sit down with yourself and you enjoy the moment. And I think meditating and going to therapy as well is so important for our mental health.
Yes, absolutely. I am an advocate for therapy. I think it really, in this day and age, having the society, we came through the worst pandemic. I think it should be in the water, right? I think I
Be just,
yeah, it should just be one of
yes,
those things. And I think
yes.
in the Caribbean community, there's a stigma that still exists. I think
Mm-hmm.
that, I do also at times challenge or push it when people tell me, oh, well, they'll just pray. And I said,
Right.
pray, please pray.
Yes.
But within those prayers, what if your prayer entailed you being able to accept therapy from, again,
Mm-hmm.
just like the nutritionist? accepting therapy in the mindset of someone who can give you tools on how to better cope and use your prayer as your medium to keep you balanced. But if you're not getting in a better place mentally, then yeah, you need to go speak to a professional, and it doesn't diagnose you as being crazy or whatever that misconception might be. It makes sense that a lot of us need therapy at this point in time. Life is hard.
Yes.
So getting the right
Mhm.
coping, if we're talking about 38.9% of women with this condition have depression, I could safely say 38.9% are not in therapy.
That's what it's saying is body, mind, and soul. And we need
Yes,
to really take care of all three elements. It's not just you pray, as you said, but it's also a combination of things that you need to implement into your life to make a holistic approach.
yes. So I would say to my patients who are very spiritual, I'm like, please pray. But
Yeah.
when you finish pray, you go run around the savannah for one lap.
In the Caribbean, we have a stigma with mental health. And I think that is so important that we consider our mental health as well as our physical health. Just how we go to the doctor to check up on our bodies, we should also check up on our mind and how our emotions and how we're doing.
But what I see here, it's the also the culture here, with carnival culture too, right? So I see women who outwardly, that from the hair, the lashes, they keep
Right.
consistent routines with certain things.
Be honest.
They're
Yes.
still struggling. So again,
Definitely.
yes,
Yeah.
looking at yourself, loving yourself as an entire complete entity is important as well, to
Yeah.
inside and out. And it's always a bit of a struggle, but keep up with the struggle and you should be in a good place.
Right. And as you said, it's not just about the outer appearance. Sometimes you need to take care of your how you're feeling, your emotions, your mental health.
I have also certain approaches, right, to help
Yeah.
you view yourself. So sometimes patients will come in, let's give an example. My hormones are off, my skin is doing weird things, I'm getting pain, my bowel movements are off. And then I'll simply sit back and say, what fruit did you have today? And then
Right.
sometimes it'll be crickets. Okay, today, what fruit did you have yesterday? Crickets. And then, oh, I had pineapples on Monday. And I'm like, that's
Mm,
not consistency. And
no.
what if all you needed to do was just have some yogurt and a fruit bowl and some granola
Yes.
more consistently? Maybe these symptoms you're here about with your hair to talk about may not be as prominent.
Right. I believe that diet should be simple and easy. And to start off, especially for beginners, start off easy. I know it could be look very complicated and complex with all these different diets and all these different fads that we go through. But I think taking it step by step, as you said, the yogurt and the fruit, that's easy, and a little bit of granola on top. Yes, I think people need to view their diet as not this hard, complicated thing, but as something, lifestyle change that you implement every day. Take it easy, just and create a simple one, a 3 ingredient meal. Yes. Do you have any other tips on managing your PCOS?
I believe one key thing, honestly, is tracking your symptoms. I think that sometimes we
Mhm.
lose the importance of that. And my more established clients will know me that it's okay to come in with writing out, well, when I do this, this happens, and so forth, because it could be frustrating. Irregular periods, for example. Patient shows me her log app because I look through their phones. I'm like, let me see your periods. And when I look, I saw this window of time earlier this year when she was spot on every 28 to 30 days.
Yeah.
And I was like, you were clearly working out then. And she's like, how did you know that? You were working out. Carnivals in
Yes.
February, you're watching what you were eating, you're doing things in a more consistent way because you had a goal. And there
Mhm.
came these spot on periods. And then life got busy, work, some project happened in May with work. She things got thrown off rail. And in that situation, don't be frustrated at yourself, is my advice. Understand you're human, and hey, okay, the last 2 months I kind of slipped a bit, but I know what to do because based on my tracking, when I do XYZ, this happens. So I think it's
Yes.
important to keep an eye on what works for you, and also what are your triggers, especially where moods are concerned. PMS, PMDD, some women at irregular periods, they have all the symptoms except the actual menstruating. Look at times when you have regular flow. What was I doing? How was I meal prepping? Probably I was.
Mhm.
Was I doing an outdoor workout group? Maybe I was doing things a little better that just simply it wasn't prescribed, so it's easy to actually forget that I was doing something to manage your situation. So tracking is a huge tip to understanding your triggers, whether it's personal triggers, the people around you might be toxic, the person you're with in a relationship might be toxic, affecting you. How does my body behave in such a certain situations? So I would say consistently tracking to know what your triggers are and to know what works. And then the other tip, practical tip that I think women with PCOS as well too, even if right now today, Liana, you are not wanting a child, in the
Yeah.
future you might, right? So it's okay to have a goal that's a bit further down the road, but still a goal that
Mhm.
you don't lose sight of. Because yeah, I may delay getting pregnant until I'm in my 30s, but who is that person that I'm presenting in my 30s when I'm ready to be pregnant as well too? So it may not be an immediate goal, but long term, that goal still depends on how I behave today.
Making sure that you take your notes on tracking how you feel and what you're going through and what did you implement to make you feel that way. It's so important so that we can, when we present, go to our gynecologist or the doctor, that they know that what works for us.
Yes. With higher yield from a consultation if somebody can show me what's been going on in a way that kind of tracks what they've been experiencing.
Yes. And having that foresight when you're young of, okay, I need to take care of my body now. If you check on a woman's health, you check on a society's health.
I love that. There's another one by Michelle Obama where she says that a
Oh,
society that does not honor and respect its woman is a society that's
mhm.
at risk of failure. Women are the
Yeah.
pillars. Women are households. Healthy woman in a household actually greatly improves the chances of the children and everyone else, from the elderly to the baby in that household, also being relatively healthy. If it's a
Foundation.
if there's a healthy woman in the household who's conscious of her health, that means she's conscious of her children's health, her partner's health, and so forth.
Yes, the women are such the backbone and the foundation of the family structure, and women need to take care of themselves so that they could take care of their children and so that their family could also be thrive and be happy. And what would be advice for younger women or to you, maybe your younger self, on PCOS and if they're struggling with it?
My advice to younger women is if you think something isn't right, something's
Mhm.
not right. It's okay. I advise younger women in that way because sometimes I meet women in their mid to late 30s who knew since 2021 that things were off, but they were told, let's say, by a family member or a healthcare professional, oh, you're young, just write it out, it'll get better. Just like my patients who are trying to conceive and not, they're being told, just keep trying, you need to relax. I don't speak like that, right? If you think
Mm-mm.
something is wrong, it doesn't matter your age. If you feel off, if you think things are not where they should be for you, then yeah, it's okay to investigate it, whether you're 21 or 41. If I advise women, if you feel physical symptoms that do not sit right with you, whether it's painful periods and you're told, oh, periods are supposed to hurt. That's not true, right? So whatever you're going through, honor what you feel and get checked.
Yes, society needs to be more sensitive towards women's issues and women's health. I know some girlfriends of mine, they voice their opinion to the doctor, say, hey, this is going on. What can you recommend for me? And they would not feel like their voice is being heard. They would feel like, oh, it's being played off and like, oh, just write it out as you said. And no, sometimes it translates to other things like maybe their work, how they function in their relationships and their school, so they can't able to become the best selves in those situations, and they just struggle in a lot of, it trickles over in a lot of parts in their life. Are there any resources or support groups with PCOS?
Well, I think that answer is quite it's situational in that the resources will have to apply based on what symptom I'm looking at, right? For
Mm.
instance, if I have an insulin resistance issue or I'm underweight, my resource
Yeah.
really is the nutritionist, right? Like, so and then the support groups that are there, I do come across forums online. I've done podcasts, there's a few PCOS groups, and I've actually, been invited to speak. There are some on Facebook groups and so forth. So if you look, you will find a support group, is my point. But within that, I want everyone to understand you are unique. So if I'm in a PCOS support group, everybody in there will have their version, because this is such a multi-layered condition, that I'm not going into that support group to look for similarities. I'm looking for coping mechanisms. And then
Mm.
also from a resource standpoint, we will talk about therapy as a resource. We will talk about the gym as a resource. We will talk about, I give ideas where I'm like, your birthday's in September, let someone pay for 4 trainer sessions at the gym instead of buying you a cake, right? So looking at your community, your support, that's where we
Yeah.
can look for those areas where I feel supported by people around me. In office scenarios, I find there's a lot of danger in the office scenario. Patient
Mm.
came in last week, 20 pounds heavier. I always ask, and if any of my clients see this, they know I ask, I'm like, what's the worst thing you ate this week? And she's been coming to me for about 3 years. She got pregnant with PCOS. Her daughter is doing well, but she now is still struggling. And I said, if I were next to you and you were eating it, I knock it out your hand. And she said, absolutely. She did have some Royal Castle, which she's allowed to do. But the Royal Castle
Yes.
right now is not in keeping with her goals for her weight.
Right.
Why did she have the Royal Castle? She actually took lunch to work. The co-workers, let's go for a walk. Someone feels so. So
Yes, I
I
see
think,
you.
yeah, so she got pulled into this, and the next thing she's having a
Mhm.
two-piece and a biscuit, right? And completely derailed her goals. So instead of heaping guilt onto her, because I know she's doing a good enough job about that on her own, I more so wanted to understand, okay, in the moment when you opted to go for that Royal Castle, what were your other options? Did you express to your
Mhm.
coworker that I'm on a health journey? She never did. Did you tell them that, hey, I actually need you all to support me because the doc told me I'm nearly diabetic, right? She didn't discuss that with them. And if you express that to your friends and coworkers and they still try to lead you astray, then you have to reevaluate the people that are around you.
Yeah, no, having that support system and being disciplined yourself too, to say, hey, I'm gonna take my lunch, but still go with your
Yes.
friends, you know.
But she's
And
human, right? And fried chicken, come on, right?
I know, I know, having grace with yourself too. Just like, okay, I did that. Let's start over again. It's okay to start over again if you made one
Right.
little cheat day. So much, Dr. Shevon, for sharing your insight and expertise. It is such an it's such an important topic. Where can we find you and connect?
Well, I am mostly housed on our website, which is azaleahealthtt.com. We are on LinkedIn. We are on YouTube. We have a series on YouTube of my pre-recorded lives.
Yes.
We're on Instagram, Facebook, TikTok. Who am I missing? I think that's it.
Yes,
Of
Instagram,
course,
yes.
and then of course, I'm accessible as well via office visits. But I also, even pre-pandemic, we've always had telehealth on board. So
Oh,
I do virtual consultations,
wow.
and not just polycystic ovarian syndrome, but the bulk of it is. And also have had clients from Antigua, Barbados, California, Nigeria. So
Wow.
actually, the couple in Nigeria, they have a daughter now. And I have not been to Nigeria, but they reached out and they booked and they did a virtual consultation because they weren't happy with their fertility screenings. And when we did the consult, they were able to send what was done, and I saw some gaps and what was needed to be done. So I did help provide a formal recommendation for their local doc to follow and so forth. So I try to make myself accessible for sure, because I think that's a key barrier for some women where their hormonal health is concerned. They research, they have a plethora of things running around in their head that they think could be going on, but actually accessibility to a healthcare provider, I think, is key.
Yeah. And remember, ladies, knowledge is power, and taking control of your health is one of the most empowering things you can do for yourself. If you enjoyed today's episode, don't forget to subscribe, rate, and review, and share it with someone that you know that needs this. So until next time, keep blooming, keep shining, and embrace your inner goddess to become the best version of yourself. See you next time. Bye.
Thank you.